Hey, welcome to MedSnap 1 Min. Did you know that the cancer of blood is called as leukemia? In our bone marrow we have pluripotent hematopoietic stem cells, which can give rise to all the different kinds of blood cells in our body.
Hi, let's talk about differentiation and maturation of PHSC. PHSC forms MSC, which in turn converts to myeloid and lymphoid progenitor. The myeloid series forms the various blast cells like myeloid, mono, baso, eosino, erythra, megakaryo. The lymphoid series forms the B, T and NK lymphoblasts. These cells convert into their mature form. Acute myeloid leukemia is the defect of immature myeloid cells, whereas acute lymphoid leukemia is the defect of immature lymphoid cells. CNPN include the defect of mature myeloid cells, whereas lymphoma include defect of mature lymphoid cells. Thank you. Stay tuned for more such 1-minute concepts.
We will take about acute leukemia and lymphomas in some other video. For this video, let's talk about chronic myeloproliferative neoplasm. Let's revise chronic myeloproliferative neoplasia together. It includes chronic myeloid leukemia, polycythemia vera, essential thrombocytopenia, primary myelofibrosis, and myelodysplastic syndrome. In CML, the main pathophysiology includes translocation 922, leading the Philadelphia chromosome formation, thus increasing the tyrosine kinase activity, leading to increased myeloid cell proliferation. In clinical features, there is hepatosplenomegaly and pain abdomen. Diagnosis can be done by CBC and PS, which shows increased TLC and garden party appearance. Further FISH karyotyping can be also done. Treatment includes tyrosine kinase inhibitors like imatinib, ponatinib, dasatinib, nilotinib. Stay tuned for part 2 of the CMPN tomorrow. Next we have polycythemia vera. For diagnosis, 3 major or 2 major and 1 minor criteria must be met. The major criteria includes number 1. Increased RBC mass with either increased hemoglobin or increase in hematocrit. Number 2. Includes panmyelosis, and number 3 includes JAK2 or MPL mutations. Among the minor criteria, we have to rule out secondary polycythemia. In clinical features, there is hyperviscosity syndrome due to increase in RBC mass. Also, there is aquagenic pruritus, that is, itching on coming in contact with water. For treatment, we can do therapeutic phlebotomy and give hydroxyurea, which is a bone marrow suppressant. Next, let's talk about essential thrombocytopenia. For diagnosis, we have to meet 4 major or 3 major and 1 minor criteria. The major criteria includes number 1. Increased platelet more than 4.5 lakh per microlite. Number 2, there is increased megakaryocyte. Number 3 includes to rule out CML and PV, and number 4 includes JK2 and MPL mutations. In clinical features, there is thrombosis in 80% of cases and bleeding in 20% of cases. In treatment, we can give salicylate to inactivate platelet. Stay tuned for the next part tomorrow. In primary myelofibrosis, there is mutation of JK2, MPL or calreticulin. There are 2 stages. In the first one, there is proliferation with high TLC and panmyelosis. In second stage, there is fibrosis, leading to pancytopenia. Blood picture shows leukoerythroblastosis and teardrop RBC. Treatment can be done by hematopoietic stem cell transplant. In myelodysplastic syndrome, there is chromosome 5q deletion, more common than 7q deletion. Here there is clonal proliferation of abnormal myeloid cell causing pancytopenia with cellular bone marrow. Stay tuned for more such mind maps at MedSnap 1 Min every Sunday.